Artificial intelligence is now diagnosing diseases, performing surgeries, and predicting who might get cancer years before symptoms appear. AI isn't just helping doctors, it's starting to replace them. But here's the real question. Is this the beginning of a medical revolution? Or the start of something far more dangerous? Today, we uncover the truth, what AI is doing in hospitals right now, what the science says, and why many experts are warning that we might be moving too fast. AI's journey into medicine began quietly as a tool to read X-rays, scan MRIs, and manage hospital records. In 2016, Google's DeepMind created an AI that detected over 50 eye diseases with accuracy equal to top specialists. A year later, IBM's Watson promised to revolutionize cancer care, scanning thousands of studies to find the right treatments. The dream was simple: machines handle the data, humans handle the healing, but things didn't go exactly as planned. The 2019 Lancet Digital Health Review found that AI diagnostic systems matched human doctors in 87% of accuracy tests. That's impressive, but medicine is not math. A patient is not just a case number. They come with fear, pain, and unpredictable biology. Dr. Eric Topol, a cardiologist and AI researcher, warns, AI lacks intuition. Medicine still needs human judgment, the kind that grows from empathy, not algorithms. Today, AI doesn't just assist, it acts independently. The FDA has approved AI systems that diagnose diabetic eye disease without any doctor present. In China, hospital chatbots are prescribing medications and prioritizing patients using voice, face, and symptom data. Even robotic surgery systems now perform operations with sub-millimeter precision. So maybe the question isn't if AI will replace doctors, it's when. But beneath the innovation lies a dark side: bias, errors, and lack of accountability. AI learns from data, but if that data is flawed, so are its predictions. A 2020 science study revealed that an algorithm used in U.S. hospitals underestimated the health risks of Black patients because it measured costs, not health outcomes. When AI gets it wrong, who's responsible? The programmer, the hospital, or the doctor who trusted the machine? Right now, there's no clear answer. Medicine is more than diagnosis, it's human touch. It's the warmth in a doctor's voice that gives hope when the data looks hopeless. AI can't comfort a crying child or sense fear in a patient's eyes. It can't read pain that isn't written in the data. Dr. Abraham Verghese from Stanford said it best: the patient's most memorable moments are human, a comforting hand, a caring word. AI cannot replace that. Despite fears, AI has already saved lives. Admit, an AI system identified early pancreatic cancer years before symptoms appeared. AI radiology tools have cut diagnostic errors by nearly 20%, according to the British Medical Journal. AI never sleeps. It doesn't forget. When used wisely, it can make healthcare safer, especially in regions where doctors are scarce. But there's a hidden danger: overtrust. Doctors may stop questioning AI's output. Patients may skip second opinions. Already, Symptom Checker is have misdiagnosed conditions, delaying treatment. A single algorithmic error can mean life or death, as one ethicist put it. A lazy doctor with AI is more dangerous than a smart doctor without it. The best future isn't about AI replacing doctors, it's about partnership. AI can scan millions of images overnight, alerting doctors to what matters most. Doctors can then spend more time connecting with patients, not just reading charts. Together, human intuition and machine intelligence could redefine medicine. AI can analyze data, but it cannot feel compassion. It can predict disease, but it can't share the pain of being human. So is AI replacing doctors safe or dangerous? The answer depends on one thing: how wisely we decide to use it. Because medicine may be evolving, but humanity must always lead the way. This is EnkoloFlow, exploring the truth behind modern health. If you value evidence over hype, subscribe for more science-backed documentaries like this one.